Good afternoon, ladies and gentlemen. My name is Thomas Laycock, and I would like to present to you the effects of a placebo on upper and lower body outcome measures. Research into the effects of placebos is fast becoming a heavily studied area, holding great promise as an area of research in therapeutics. A placebo can be defined as any therapy prescribed knowingly or unknowingly by a healer or used by a layman for its therapeutic effect on a symptom or disease, but which is actually ineffective or not specifically effective for the symptom or disorder. Studies such as the one referenced on screen have found that tests completed with Parkinson's patients showed improvements varying from 9% to 59% when given a placebo, comparatively with an experimental drug. Studies such as this show that there is indeed an effective use for placebos. The effectiveness of this, however, is found to be more prominent in pain, depression, and Parkinson's disease. Whilst the majority of studies use mental disorders or developmental disorders, there have been studies completed that look at placebos in relation to exercise protocols, with the use of supplementation intervention being heavily involved in the majority of these. A study completed in 1999 was conducted looking at the effects of a placebo in relation to performance, which introduced a carbohydrate feeding and a placebo on a cycling trial. In this study, it was found that both the carbohydrate feeding and the placebo resulted in greater levels of performance, and determined that a placebo implemented into a trial lasting approximately 1 hour resulted in a worthwhile increase to endurance power. These findings coincide with another study looking at chromium picolinate that found consistent results with the use of a placebo and increases in endurance power. From this, the hypotheses that are determined, as the null being that there will be no significant difference between trials when introducing the placebo to the participants, and the ultimate being there will be a significant change in results relative to the baseline measures and the post measures. The study was determined as having a within-subjects design and aimed to determine the effect of a placebo on strength and endurance outcomes of upper and lower body exercises. The participants for this study were 15 males volunteering to participate, with a mean age of 23.1 years, a stature of 174.17 centimeters, and a mean body fat percentage of 14.2%. It was ensured that all participants had been performing upper and lower body strength training for at least 3 days a week for the last 6 months leading into the trial, that they had not consumed ergogenic aids within the 4 months prior to testing, and that the participants agreed to refrain from resistance exercise for the duration of the investigation. The study was broken down into the following stages: a familiarization stage, where participants were familiarized with each of the testing procedures, the 1 repetition max, bench press, and 1 repetition max squat, as well as a maximal amount of repetitions at 80% of their 1 repetition max for both bench press and squat exercises. The baseline stage was where participants' 1RM and muscle endurance tests for bench press and squat exercises were recorded to determine a base level before the placebo was given. Testing session 1, where participants were tested again after taking the placebo for 4 days, assuming it worked. Testing session 2, participants again completed the testing after being told the placebo was ineffective. The same warm-up was used on the Monarch bike for 5 minutes prior to all exercise on all of the testing stages. On the baseline day, anthropometric data was collected, including height, weight, and body composition using a 3-site skin fold. Participants then completed a 1 repetition max and muscle endurance test for bench press and squat exercises. After the baseline results were established, participants were given a food diary to complete for the 4 days between trials, and were also given a 4-day supply of the sugar-based placebo and told that it was composed of a powerful amino acid compound that has been proven to increase skeletal muscle strength and endurance by 10 to 15%. Subjects were also given a supplement adherence log to complete to ensure the supplement was being properly consumed. Come testing session 1, participants completed 1 repetition max and muscle endurance test for bench press and the squat exercises again. Subjects were given another food diary to complete for the 4 days prior to their next testing session. However, at the end of this test, the participants were informed that another university just completed an independent study of the supplement and found the supplement to have no effect on skeletal muscle strength or endurance. The supplement does not work. They were then instructed to continue consuming the supplement 3 times a day and given another supplement adherence logbook to ensure supplements were being consumed properly. Testing session 2 saw the participants complete 1 repetition max and muscle endurance tests for bench press and squat exercises using identical procedures to those performed during testing session 1. On this day, nothing additional was given to the subjects. After completion of testing session 2, participants were contacted by a research assistant and told them the purpose of the study. All subjects were also told the supplement they consumed during each phase of testing was a sugar tablet. All of our statistical analysis were run using the Microsoft Excel data analysis toolpack. For the bench press and squat data, single factor ANOVAs were run with a p-value of 0.05. The same statistics were run for all the collected nutritional data with the same p-value being used. As you can see in the table now on screen, there were no noted significant differences found in the results, represented by the mean plus minus standard deviation shown in the table for bench press baseline, test session 1 and test session 2, or for the results of the squat data for the 3 testing stages as well. As seen in the p-values now on screen, it was determined that there were no significant differences for any of the nutritional intakes of the participants. The findings of this study are surprising, as they are contradictory of those that can be found in the current literature. An example of this is a study that was completed in 1972. This study used varsity athletes who believed they were receiving a strength-enhancing substance, when in fact a placebo was used. Contradictory to the results of our study, it was found that there was a significant difference and increases in strength outcomes when participants believed they were receiving performance-enhancing substance. Although there are some strong similarities between the 2 studies, difference that must be noted is the duration, as theirs was a training period that lasted over 4 weeks. Again, the results are contradictory to that of current research. An investigation introduced a placebo along with creatine supplementation to a group of female softball athletes over a short period to determine if there are any effects of torque and power outputs. There was found to be significant increases in mean strength and endurance over the final 2 weeks when the athletes were given the placebo. The similarities in duration of this study to the one completed, only differing by 2 days, make for an intriguing finding in such results. And it may be due to a female population being used in their study that different results were found. Our findings may result from the participants only believing that their placebo was effective for a total of 4 days. With belief that the placebo does not offer any effectiveness revealed after the first 4 days, this may have taken away from the psychological impact of the placebo that seems to be a resultant factor in other studies that are presenting significant results and can be determined as one of the possible reasons that no significant differences were found in the outcome measures. There was also no differences found between any of the nutritional data, and if they were, it was intended to be used as a possible explanation for any significant changes that may have been seen in the power measures. So conclusively, the placebo effect was unapparent in upper and lower body strength and endurance exercises, while the placebo is either believed to be effective or told to be ineffective. As results of this study returned no significant differences or any improvements, it has been determined that there are no practical implications associated with this study. I would now just like to acknowledge Dr. Vincent Darlow, Mr. Patrick Tucker, and Central Queensland University for their assistance in the completion of this study.